is it possible, once we go to brain criteria for death, that there could be some minor functions of the brain that would be retained while full standing is lost and we've already transitioned over to partial standing? For example, the base of the brain, there are certain reflexes that are mediated through the brainstem: a gag reflex, an eye blink reflex, cough reflex. If you have bought brain criteria for death, and many people of conservative and liberal persuasion have done so, you then need to face the question, does anything left in the brain signal full standing? Can it be that we don't know whether you're alive or dead until we know whether you gag? Somebody puts a finger in your throat and you gag, aha, that's full standing. That doesn't make much sense. So what many people who now opt for a higher brain view are saying is, if you've gone to brain criteria for death, those reflexes in the brainstem can't really make that much difference. Now, that doesn't permit you to move on to the advanced Alzheimer's patient. The advanced Alzheimer's patient, no matter how debilitated, has a lot more than a gag reflex. They're conscious in some sense. They feel pain. They feel certain emotions. So there's a lot of brain activity present. I know of no one who is seriously proposing that we treat someone as having lost full standing when there's any cerebral function left. By cerebral function, I'm referring to consciousness, capacity to feel, to think, to emote. Any of those cerebral functions surely have to be signs of life in the sense that you're a full member of our community. Maybe a very sick member of our community, but you're a member of full standing, and there are many things we just can't do to you. We can't use you for a research project that would end up taking your life. And we can't take organs from you if you're a member of the community in full standing. The three definitions of death that I talk about in the text are all plausible candidates held by some portion of the population, trying to answer the question, when do we transition from full standing to partial standing? And in the back of our minds is the practical question, when can we do things like taking organs? Now, taking organs from a dead person is not killing them. You can't kill dead people. Once you're dead, you're dead. So when we label someone as deceased, as dead, the moral and legal standards for killing no longer apply. That means it's crucial that we get the answer to this question right. And no one that I know of is seriously proposing that advanced Alzheimer's patients are dead in this moral and legal sense of the term. There are people who are proposing that you're dead if you've lost all your brain functions. And there are some people who are proposing that you're dead if all you've got left is a gag reflex. But if you've got any cerebrum left, almost certainly you're a member in full standing. At least if you have sensory cerebrum left, you're a member in full standing in the moral community, and we can't do things to you. For example, we can't kill you any more than we can kill any other member of the moral community. Some of us believe that it's always wrong to kill those who have full standing. If you take that literally in all cases, that means you oppose capital punishment. You might even oppose all killings in war. It might be a pacifist. But certainly you couldn't kill someone by taking life-prolonging organs. On the other hand, when they've transitioned over to partial standing, when they're dead in the usual sense of that word, then it's okay to take organs, and you're not killing them when you take organs because they've already been classified as dead.